our partners. The impact of this pandemic on all of us has been incredibly difficult. When we started in March of 2020, facing the first days of COVID, trying to figure out what our life was going to be like and how we could protect people, it seemed like an insurmountable challenge. And yet we came together and we did. We met the challenge. Healthcare workers have come to hospitals, to clinics, to public health arenas for the last almost 2 years, day in and day out, taking care of people who are at an incredibly vulnerable point, frightened, and trying to keep themselves and their families safe. I'm here now to say we need your help. We are at a point of breaking. The hospitals in the Denver metro region are full. We're running 5% of our capacity being available, 5% of our ICU beds, 5% of our medical surgical beds, and not just for COVID, for anything that a patient needs to come to the hospital for. Emergency rooms are routinely diverting patients because they simply don't have the capacity to take care of people who need help. And this is not a sustainable situation. Doctors, nurses, clerks in our clinics, people who serve food and clean the rooms, every single person who has been involved in providing health care over the course of this pandemic are stretched to the absolute limit. They are exhausted, they are tired, and they need the help of the people of the region to get this under control. The idea that we have 80% of the patients in the hospital who have COVID who are unvaccinated, that people have chosen not to get a vaccine and are ending up in the hospital and stressing the healthcare system, is completely unfathomable to me. But we need to make a change now. During the course of 2020 and into 2021, as you know, healthcare services were not as readily available. People were told not to come to clinics, not to come to hospitals, and to wait until we could come up with a solution that would protect them and their families. And now we have one. We're dealing with the backlog of people who need care, who needed care during the course of the pandemic and put it off. They're coming into hospitals now sicker than ever before, and they're coming in larger numbers than we've ever seen before. Our system is on the brink of collapse, and I don't say that to be a fear-mongerer. We truly are at a point where we cannot continue to do what we are doing without help from the people in the metro region. So Bob said this was a difficult decision to make. I'll tell you, it's a difficult decision, but not if you walked into one of our ICUs and saw people gasping for breath. Not if you watched a nurse walk out of a patient's room and break into tears because she hasn't been able to do anything to help them and their family. It wouldn't be a difficult decision if you talk to patients who are afraid to go to a hospital even though they're suffering from a serious health illness, because they just don't know if they're going to be able to leave that institution safely. We need the help of the people who live, work, and play in the Denver metro area. We need to come together to deal with this so that we don't get to the point where a patient walks into one of our hospitals and is told, "We can't help you." That has never been a sentence that comes out of the mouth of a person who is dedicated to taking care of people. Healthcare professionals do not want to say that, but we are perilously close to it. So I ask for everybody to come together to get vaccinated. If you're not vaccinated, to wear the mask, to help us get through the next several months, because my fear is that it would be any one of us who could walk in and could need help. And we'll find that the system that is designed to be there in our time of need is not able to provide what you need. So please, think of the healthcare workers, those you counted as heroes last year, are standing here asking for your help to get through what we're facing. We can't do this by ourselves, and we need everybody to come together. So thank you so much for getting vaccinated and for cooperating with the public health orders.